With regards to hair loss, the first thing we have to look at is the cause. What's actually causing the hair loss? So is it an environmental factor? Is it that you've got traction or physical traction from weaves or extensions? Is it a hormonal factor? Is there something happening with your thyroid? Or could it be an iron deficiency? Or is there some kind of life event? Normally, after life events such as a job loss or bereavement, your hair cycle responds 3 to 6 months later. And those are the kind of questions we ask you about. The other thing we actually look at and tend to ask now is, did you suffer from COVID? And did you find that after 3 to 6 months that your hair was shedding afterwards? Because in COVID, when you have an infection like that, or any serious infection in your body or inflammation, what your body does is it protects its major organs and it allows the minor organs that it considers, the skin and the hair, to take care of itself. And that's why your body goes into shock a few months later. Now, in terms of the hair cycle, what we look at is we take the hair follicle and we turn around and say, is it in the telogen effluvium stage, i.e. in the shedding phase of the cycle, or is the root bulb, i.e. if it's round, in the anagen phase, the growth phase of the hair cycle? Because that's key. Diagnosis is key, number one. Number two, what we want to do is we want to assess the areas of recession or shedding or hair loss. So commonly, most people think that male pattern baldness runs after the male side of the family. It doesn't. It runs after your mum's side, unfortunately. Number one. Number two, female pattern baldness is on the rise. Alopecia is on the rise as well, especially with lifestyle changes, environmental changes, and especially with the traction and pulling techniques that we're doing in our hair and with styling and weaves and extensions. So what we have to look at is, where's the hair loss? Is it temporal? Is it frontal? Is it generally or global? Once we look at that, and once we look at the hair follicle, we can decide what treatment modality we can use. Do we do injectable steroids? Do we use exosome stem cells? Do we turn around and use growth factors in your own stem cells and re-inject it into the scalp to cause the scalp to move from the shedding phase, the telogen effluvium phase, into the growth phase of the cycle? Because remember, it's all about bioavailability. If I'm going straight to the root cause and I'm giving you 90% plus bioavailability of growth factors, stem cells, lots of nourishment and lots of different formulations in here, we're moving your hair from shedding to growth. So what you're going to find is you're not going to find the cold as much. You're going to, in a few sessions, you're going to feel some baby hair growth. And when you put your hand through your hair, hopefully it will feel a lot thicker. I'm a prime example of hair loss treatment.